removing your tailbone or coccyx, and if you should or should not do. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I have been asked what my thoughts on the subject of tailbone pain, removing it because it seems like nothing else is working is. So unless it's 100%, like let's say you have some kind of a terminal disease that requires that to be removed, I would go out to say that I'm against it. It really depends, but you have to understand, despite what people say, or the whole mindset of, oh, your tailbone, you don't need it, this is part of evolution and it was a tail, forget about that part. It actually plays a role in providing an anchor to a lot of ligaments, and it provides support for a lot of structures in your pelvic floor, pelvic wall, the integrity of your whole pelvis. It's not there just to hang out there. It's not there because, you know, it was like extra body part, what are we going to call it? Call it coccyx and put it in the pelvis situation. It actually has a function. So it's like a tent. So you put a bar right here to have an apex for a tent, to build a tent around. Look at it like that. While you're under that tent, without that tip, the tent's gonna fall. So this coccyx or tailbone actually provides quite a bit of structural integrity support for the muscles, ligaments, tendons, and connective tissues there. So if you're told, oh, your tailbone doesn't seem to go away, let's remove it, you're more than likely trading one problem to a set of a bunch of other problems. So there is a good chance that your tailbone is not treated properly. And so I suggest you take more than second opinion, maybe a third or a fourth, because it's very easy to not treat that area properly, more than likely because patients don't want the internal work done. And before you remove something, make sure that the internal work has been done. There's value in the external work on that area, but there's also value on the internal treatment of your coccyx as well. If you have any questions, make sure you use one of the methods of contact in the description box, and make sure you subscribe to the channel. Until next time, take care.